Everyone, so today I will teach you people about Norma Basalis. So already we have studied about Norma verticalis, Norma lateralis, Norma frontalis and Norma occipitalis. So main thing is Norma Basalis. So this Basalis is important because it will be present base of the brain. It has to be hold the brain. So you know brain is a CPU of a man. It will be very huge functions. So this has to be hold and it is present in the base. So that's what it is, Norma Basalis. So Norma Basalis is more important compared to all the normas. So this Norma Basalis, so it will be easy to study. We can divide it into three parts. One is anterior part, middle part and the posterior part. So how you can divide anterior part of the Norma Basalis? And you can see here, this is the hard palate. So this is the hard palate. So posterior part of the hard palate, we can put one imaginary line over here. So which is anterior to that, we can call it as anterior part. Posterior to that we can call it as middle part, and here while it goes back, here you can see the Styloid process. We'll write on imaginary line of the Styloid process. So this imaginary line of the Styloid process. So this anterior to that we can call it as middle part, and posterior to that we can call it as posterior part. So now we are divided into three parts. One is anterior part, middle part and the posterior part. So now come we can study the anterior part of Norma Basalis. So this anterior part of the Norma Basalis has a 16 sockets. So this 16 sockets from the maxilla, that is maxillary sockets. Here you can see the 16 teeth. So you know the dental formula: 2, 1, 2, 3, 2 incisors, 1 canine and 3 molars, 2 molars and 3 premolars. So those are the sockets will be present in the maxilla. So while it goes inside, here you can see the small V-shaped suture in the maxilla bone, that is called premaxillary suture. So you can make out here. So this is a suture. It will be V-shaped suture, that is called premaxillary suture because it is present in the maxilla. It will be front. So we can call it as premaxillary suture. In front of that we can see one foramen. So this is incisive foramen. So this is the incisive foramen because it is present behind to the incisor teeth. That's what it is, incisive foramen. Here you can see the posterior ethmoidal artery and vein will be passes through there. So this is incisive foramen and it is present within the premaxillary suture. So then goes back, here you can see centrally. So this is the maxilla bone, what I told. So this is intermaxillary suture. So this is in between the maxilla, we can call it as intermaxillary suture. So these two are the maxilla bone. So this is intermaxillary suture. Well goes, here you can see the palate bone. So there is no soft palate in the skull bone, only we can get the hard palate. So this is the hard palate. So in between you can get suture, that is interpalatine suture. So this is intermaxillary suture, this interpalatine suture. So horizontally we can get one more suture, that is palatomaxillary suture. So this is intermaxillary, interpalatine and palatomaxillary suture. So these are the three sutures mainly we can see in the maxilla bone. And lateral to that, here you can see in the hard palate. So this is a foramen. Here you can see the two foramens on each side. So what I put a probe here, this is greater in size compared to another foramen. So that's what it is, greater palatine foramen. So it will be present in the palatine bone and it is greater in size, that is greater palatine foramen. So this what I told, this is a greater in size, that's what it is, greater palatine foramen. Behind that we can get one small foramen, that is lesser palatine foramen. So this is the lesser palatine foramen, this is the greater palatine foramen. It is present in the palatine bone, that's what it is, greater palatine foramen. So this greater palatine foramen for greater palatine artery and vein and the nerve. So this lesser palatine foramen for lesser palatine artery and the vein. So this is a two foramens along with the incisive foramen, that is important in the maxilla bone. So that is, and here you can see the maxilla bone, and inside you can see the maxillary sinuses, those are the paranasal sinuses bone, and laterally you can see the zygomatic bone and the zygomatic arc. So these are main part in the anterior part of the Norma Basalis. So while it goes down, here middle part of the Norma Basalis is more important. Here we can get more foramens. So this is middle part of the Norma Basalis. It goes back, here you can see the omer bone. So this is the omer bone that will be divides the anterior nasal aperture into two compartments, and lateral to that, here you can see the pterygoid fossa. So this is the pterygoid fossa. Fossa is a depression. So this is from the pterygoid plate. This is pterygoid fossa. So in the pterygoid fossa we can get two plates. One is lateral, one is medial. So this we can call it as medial pterygoid plate. This we can call it as lateral pterygoid plate. So these two plates are important because muscles of mastication, so masticated muscle will be formed by medial pterygoid, and the lateral pterygoid muscles has to be takes origin from the pterygoid plates. So that's what it is, medial and the lateral pterygoid plate and the vomer bone. It goes laterally. So here you can see this is a oval in shape. So foramen will be present ovally. So this foramen we can call it as foramen ovale. So foramen ovale because depending on the structure, this will be oval in shape. That's what it is, foramen ovale. So here you can see the fourth structure will be passes through this meningeal and accessory pharyngeal artery, emissary vein, lesser petrosal. Now all the things will be passes through there. You can remember as a mnemonic male, M-A-L-E passes through with foramen ovale. So just posterior to that we can get one small foramen that is called foramen spinosum. So this is the foramen spinosum because it is present in front of the spine of sphenoid bone. So this is the spine of sphenoid bone. So what I am marking here with the chalk, that is spine of the sphenoid bone. In front of that we can get a foramen, that is foramen spinosum. In front of that foramen ovale. So this foramen spinosum has a structure will passes through with that. Then sphenoid, this is a sphenoid process. This is the spine of the sphenoid. Spine is a needle like, that is from the sphenoid bone. This sphenoid process are important because sphenomandibular ligament and tensor veli palatinae, tensor palatinae muscles will be arise from here. So those two muscles will be attached here, and one ligament, that is sphenomandibular ligament. Sphenomandibular ligament, you know, that is come from the deep cervical fascia, has a superficial lamella and the deep lamella. Superficial lamella attaches to the zygomatic arc and deep lamella attaches to the spine of the sphenoid. It will form a ligament, that is sphenomandibular ligament. From here it will be attached to the angle of mandible. So all goes down. Here you can see the fossa that I already told. This is the condylar fossa. This will be articulated with the mandible bone and it will form temporomandibular joint. So just medial to that, here you can see the styloid process. So this is very, very important. Styloid process, it has styloid apparatus. So from this you can get two ligaments and three muscles will be attached over there. One is stylopharyngeus, styloglossus, and so those two muscles along with three ligaments, stylomandibular ligament, those are all will be stylohyoid ligament, stylohyoid muscle. So those are all three muscles and two ligaments will be attached to the styloid process. You may get a question, what are the styloid apparatus? So that time you have to write about three muscles and the two ligaments. And lateral to that, here you can see the mastoid process that I already told. And in between the styloid process and the mastoid process, we can get one foramen, that is stylomastoid foramen. So through this you can get a facial now. So this is stylomastoid foramen and foramen ovale, foramen spinosum, spine of the sphenoid bone, and foramen rotundum. So this is a foramen rotundum and jugular foramen. So this is the jugular foramen. So jugular foramen is important because this jugular foramen is again divided into anterior, middle and the posterior part. Anterior part for the nerves, posterior part for the internal jugular vein. Because of internal jugular vein passes through this, we can call it as jugular foramen. And beneath this, so this is the occipital condyle. This occipital condyle articulate with the first cervical vertebra. It will form atlanto-occipital joint. Beneath that, we can get one canal, that is hypoglossal canal. So this hypoglossal canal for hypoglossal nerve. So same thing in this side also you can see foramen ovale, which will be oval in shape, foramen spinosum, spine of the sphenoid, and styloid process, stylomastoid foramen, and mastoid process. So here you can see foramen rotundum, lacerum, and hypoglossal. So this is a jugular foramen and hypoglossal canal. So that is about medial compartment. Coming to the posterior compartment is very less because we already discussed about occipital part. So this occipital bone has a three parts. One is commus part of the occipital bone, and condylar part of the occipital bone, and basilar part of the occipital bone. So this basilar part will comes to the medial compartment of the Norma Basalis. So here you can observe one tuberosity will be present in the basilar part of Norma occipitalis. Basilar part of occipital bone. This what I marked here is a pharyngeal tubercle. This will helps to attachment of muscles like superior constrictor, middle constrictor, and inferior constrictor. Those will be part-like structure. So that has to be arise from pharyngeal tubercle. And coming to the posteriorly, you can see the condylar part. So this has to be articulated with the cervical vertebra. And this big foramen, it will be mega in size. We can call it as mastoid. So this is foramen magnum. So this is the mega incisors. Foramen magnum is again divided into anterior part and the posterior part. Here we can get a ligaments. So those are alar ligament and apical ligament. Those will be divided into anterior and the posterior compartment of foramen magnum. So this, what you can see anteriorly, this is osteoligamentous, and what you can see posteriorly, that we can call it as neurovascular bundle. So this is osteoligamentous, this is a neurovascular bundle. Osteoligamentous, why they will called means dense of the axis bone, it has to be comes over here, dense of the axis, and along with the ligaments, what I told, alar and the apical ligament has to come in the anterior compartment of the foramen magnum. And why they will call neurovascular bundle? Because of the presence of spinal cord and the vertebral artery passes through with posterior part of the foramen magnum, we can call it as posterior part of the foramen magnum. When they will ask for a foramen magnum, you have to divide first anterior and the posterior, then you have to write about osteoligamentous and neurovascular bundle. So then going to the posterior part, here you can see the Norma. So this is external occipital crest. This is from the inion. Inion is the most prominent part from the external occipital protuberance. Crest for the ligamentum nuchae, and this is inferior nuchal line. What you are seeing here, this is the inferior nuchal line, and this is the superior nuchal line. So this inferior nuchal line and superior nuchal line, what I told on the day itself, this will be divided the scalp and the neck region. So here you can see some of the muscle attachment, and so this is the mastoid process laterally, and this groove for posterior belly of the digastric muscle, and mastoid foramen for artery, occipital branch of meningeal branch of the occipital artery along with the emissary vein, and hypoglossal canal. So thank you all. I think people will be understood about Norma Basalis. Read, revise, you make it. Thank you.